Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. My wife Jean lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are continuing to join our webcast, so let's give them just another few seconds and then we'll get started. Thank you to all of you who are joining us on GoToWebinar, Facebook Live, and YouTube Live. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our experts today, please feel free to post your questions on Facebook Live or YouTube, or type them into the question box if you're joining us on GoToWebinar. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And I'd like to acknowledge and thank today's program sponsor, Sanofi Genzyme. Support from MS community partners helps the Society reach their goal of providing up-to-date information and support through programs like Ask an MS Expert. Today, we're talking about living well with MS, and that really has two related components to it. You have to consider both physical well-being and emotional well-being. So first, we're going to talk with Dr. Mary Alyssa Willis, an MS specialist and department chair at the University of Mississippi Medical Center. We'll talk with Dr. Willis about how to best manage your overall physical health to help you live well with MS, and then we'll talk with Dr. Deborah Miller, a social worker and director of comprehensive care at the Mellon Center for Multiple Sclerosis at the Cleveland Clinic. And Dr. Miller will share her insights on addressing emotional well-being as an important part of living well with MS. So first, I'd like to welcome Dr. Willis. And Dr. Willis, thank you so much for being with us today.
John, thank you so much for that kind introduction, and thank you to the National MS Society for having me today. Like most neurologists, I spend a lot of time talking about disease-modifying therapy, so I'm super excited to be here today talking about all the other things that are important in living well with MS.
Well, when we talk about all those other things, we know that paying attention to your general health is important for everyone, especially those people who are also living with chronic illness. When you're talking about overall general health with your patients, what does that entail?
Well, John, people with MS aren't just a central nervous system. They're a whole human being, and that means, their physical health in terms of any other conditions that they may have, and not just medical conditions, but exercise, sleep, diet all fall in with general physical health. And then there's mental, emotional, spiritual health that goes along with that. So when I think about overall health, I'm thinking about an overall human being and all the things that go with that person feeling well and functioning well and, living to their best ability.
So are there specific categories of health that fall under general health?
When I think about general health, I think about not just, medical conditions that someone may have, but also, I think about ways that we can prevent people from having medical conditions. So, most of us think about vaccinations in that category, but there's also, screening for cancer that goes in with general health. And diet and exercise are also important in the preventive health category.
Well, let's talk about that preventive aspect of health that you mentioned. We've heard that it's not uncommon for someone living with MS to also have one or more additional chronic health conditions. Can you tell us what these other conditions might be and how they can affect someone's MS?
That's absolutely right, John. I tell people with MS all the time that I wish that having multiple sclerosis would give you sort of a get out of jail free card or a pass on having any other condition in life, but that's just not the case. People with multiple sclerosis also have high blood pressure. They can have diabetes. Obesity is more common among people with MS than the general population. Sleep apnea is also a big problem. Thyroid disease is more common among people with MS. And then there are high rates of depression and anxiety, which you'll hear about later from Dr. Miller. Now, these conditions can sometimes delay the diagnosis for people with MS. So it has actually been shown in several studies that the more comorbidities or the more medical problems that someone has, the longer it takes to get to an MS diagnosis. And also, the more medical conditions someone has, the higher their risk of disability progression. So, recognizing other medical conditions is important, not just in making the diagnosis, but also in keeping someone well and preventing disability.
So it sounds like someone's care team can often include professionals, experts that go beyond treating MS. Which healthcare providers should be helping with preventing or managing some of these other conditions?
For sure, many people with multiple sclerosis think that the neurologist can manage everything, I have to admit that there are some areas where other physicians or advanced practice providers are in a much better position to do screenings for things like cancer or manage conditions like high blood pressure than I am. So, everyone who has multiple sclerosis should not just have a neurology team, but they also need a primary care physician. Depending on the other things going on with them, they may need psychologists on their care team. They may need physical therapist or occupational therapist, or even other physicians with other specialties. For example, someone with bladder problems may need to see a urologist.
Well, Diane has reached out and said she has several health conditions that she's trying to manage, including diabetes, high blood pressure, thyroid issues, and her multiple sclerosis. And Diane wants to know if you have any tips on how to get her different doctors to talk with each other. She says it's been a real challenge for her.
Diane, thank you so much for that question. And first, I'll say that you're not alone. Many people with MS are struggling to manage other health conditions as well. As far as how to get your doctors to talk to each other, one possible way to do that is to have your doctors or your care team within the same health system. That's not always possible, though. Sometimes someone sees a primary care physician close to where they live, but they travel a few hours to see their neurologist. Having a connected health record is another way to keep the doctors or the components of the care team in communication. Don't hesitate when you go to your appointments to remind whichever doctor or nurse practitioner you're seeing to send a letter to the other people on your care team who are important. I love it when a patient comes in and says, Dr. Willis, don't forget, my primary care doctor wants to know what we're doing in our visit today. That's always a good reminder for me, and it makes me stop and check and make sure that my records are up to date and that I'm sending the information to the right person.
A couple of minutes ago when we were talking about the preventive aspects of health maintenance, it occurred to me, are there any key preventive health screenings that people with MS should consider because they are diagnosed with MS?
So, everyone with MS or just every adult in the population in general should have certain preventive screenings. And the timing of those preventive screenings, like a mammogram for women or colonoscopy for everyone, is based not only on CDC recommendations, but also the age of the person and their family history. So MS or no MS, everyone needs those preventive screenings, and the timing and the exact screening will be determined based on those other factors. Now, some people with MS, depending on which medications they're on and which medicines they've been on in the past, may need more specific screenings at a different time. For example, there are some MS medications that are associated with an increased risk for skin cancer. So seeing a dermatologist yearly, having an annual skin exam would be a recommendation for preventive screening that applies to some people with MS who wouldn't have needed those things otherwise.
When it comes to managing these comorbidities or other health conditions outside of MS, are there things that people can do on their own to either prevent or manage some of these conditions?
Absolutely. So things that people can do to lower their risk of having other health conditions and also to manage those health conditions are to pay attention to the things that they do every day. Eating a healthy diet is important. Getting regular physical activity is important. Getting good sleep, managing stress, all of those things are important to not only feeling well and functioning well, but also preventing complications in the future.
I'm glad you mentioned eating a healthy diet because people with MS often ask what foods are the ones that they should be eating or what foods are the ones that they should not be eating. What role does diet, what role does nutrition play in multiple sclerosis?
You know, this is one of the most frequently asked questions that I get in clinic is what should I eat or what should I avoid eating? We actually have very little data to point us in one direction or another. We've known since the 1950s that diet was important in MS. Back then, there was a popular low-fat diet called the Swank diet, and since then there have been many diets studied. So low-calorie diets, intermittent fasting, paleo, gluten-free. You know, there are small observational studies with all of these diets, but the results are kind of disappointing. And part of that is because these studies are really difficult to pull off. You know, what we know overall is that it's important to eat a healthy diet. And generally a healthy diet includes plenty of fruits and vegetables, includes lean proteins such as fish, chicken. Doesn't mean that you can't have red meat or that if you have a steak every now and then your MS is going to get out of control. But it means that generally, you know, lean proteins are better. Whole grains should be a part of a regular healthy diet. Whether you need to limit sugar or gluten in your diet really depends on some of your other medical issues. So the diet with MS does still have to be individualized, but it's important to eat a diet that's healthy overall.
Carly is asking whether being overweight can have an impact on her MS symptoms or her disease progression.
That's a great question, Carly. And we know that children and adolescents who are overweight or obese have a much higher risk of developing multiple sclerosis. We don't see that same risk association with adults, but being overweight or obese is thought to be a pro-inflammatory state. So there are some thoughts that it may make it harder to control the MS. That hasn't been proven. But we do know that being overweight or obese increases the risk of having things like high blood pressure, diabetes, high cholesterol, which are associated with earlier progression with MS. Being overweight or obese can increase the symptoms that someone has with MS. As you can imagine, if you're having a hard time walking and you gain 20 pounds, it's much harder to carry around that additional 20 pounds. So that leg fatigue and difficulty walking can be even worse if you're heavier.
I think I heard you already start to answer this next question, but it probably bears repeating a little bit. We heard from Martha, who said she read about a diet that claims it will cure MS. What do you tell your patients who ask about special diets proposed as treatments or even cures?
Yeah, so you know, I'm very honest with my patients who ask about that. We don't have any evidence that any one MS diet is better than another, or so-called MS diet. So I wish that there was a diet that would cure MS. I would write prescriptions for that all day long and gladly move on to, you know, to a different field of neurology if that was the case. But there is no diet that is an MS cure. And whether we're talking about diets, supplements, devices, anything that really touts itself as an MS cure right now is just, it's too good to be true. You know, and when it comes to specific MS diets, you should really let your doctor, your care team know which diet you're trying. That can be important, especially if you come back in for follow-up and you've lost a significant amount of weight. It makes a difference to me if the weight loss was due to changes in diet versus whether it was unintentional or not. You know, some diets also mean that we need to check vitamin levels more frequently. So, you know, whatever diet you choose, it's important that you let your care team know that that's what you're doing. And that you also feel well on your diet and feel that it's something that you can maintain.
Tammy reached out, said she's 42 years old. She was diagnosed with MS 2 years ago. In general, Tammy keeps a healthy diet, but she's wondering if she should consider adding nutritional supplements or vitamins to her diet. Dr. Willis, what do you have in the way of general advice for people considering nutritional supplements or vitamins?
Yeah, John. So just like I mentioned, there are some diets where people do need specific supplements. For example, someone who is a very strict vegetarian is at risk to have B12 deficiency and would need B12 supplementation. So depending on what diet someone follows, there may be a very specific need for vitamin supplements. As far as vitamin and nutritional supplements with MS in general goes, we don't really have much evidence to support use of any type of supplement in MS. Now, there have been many that have been studied. So things like biotin, omega-3 fatty acids, alpha lipoic acid, vitamin E, B6, B1, or any of the other B vitamins. All of those things have been studied, and some of them actually in larger studies, but we don't have any evidence that those things help. Now, most are not harmful, but sometimes supplements can actually cause a problem. So some supplements can actually put more strain on the liver, for example. And if you're taking any supplements, you should let your care team know that you're doing that. That may change the lab monitoring that we do. And when it comes to vitamin D, so vitamin D is one of the vitamins that is closely linked to multiple sclerosis. So we know that having low vitamin D increases the risk not only of developing MS, but increases the risk of MS activity. So generally, all MS neurologists are recommending supplemental vitamin D and at least annual checks of vitamin D levels. But that's the only vitamin that I uniformly recommend.
So let's talk for a minute about unhealthy habits that could have an impact on MS. Mark reached out and said he's 46 years old. He was diagnosed with MS 5 years ago. He eats healthy and exercises, but Mark also smokes and drinks socially. And Mark wants to know how much of an impact smoking and drinking have on MS.
Yeah, that's a great question, Mark, and congratulations for eating healthy and exercising. Those are great habits to keep up. The smoking is something that increases the risk of having multiple sclerosis. It increases the risk of MS activity. And some of the more recent studies have shown that people with MS who smoke may have brain aging faster than people who don't smoke. So we see decreases in brain volume at a rate that's different in smokers than non-smokers. So the smoking is not good for people with MS. It's not a healthy habit in general, but it has specific implications for people with MS. Now, there's not a clear association between alcohol consumption and the risk for MS. But let me remind you that alcohol depresses the central nervous system. So for someone who's already having difficulty with nervous system function, overdoing alcohol is not a good idea. And then there are some medications where we really shouldn't mix the medication and alcohol. And many of the medicines that we use to treat MS symptoms fall into this category. For example, medications for spasticity like baclofen really shouldn't be mixed with alcohol. Talk to your care team about the specific recommendations for you. So if none of those things apply, if you don't have medications for which you should avoid alcohol, then the general recommendation is to stay within the CDC guidelines for alcohol in moderation.
A lot of people are asking whether there's any new research on these topics we've been discussing. Is there anything new that you can share with us?
Well, John, there are many, many studies going on looking at diet, looking at exercise, looking at, what type of exercise is best, and not just what type of exercise is best, but how can we tailor that to a specific person based on how active they are, how much fatigue they have, their other comorbid conditions. So there are studies going on looking at physical activity, the best ways for people with MS to be active depending on their overall profile. There are still dietary studies going on. One very popular study right now is a study of the Walls Protocol. There are studies looking at the gut microbiome to understand the role of the gut in developing multiple sclerosis and how we can heal the gut and whether that makes a difference in MS control. So there are many, many studies going on right now looking specifically at diet and exercise.
Flu season is here, so I want to make sure we talk about vaccinations. Many people living with MS have concerns about the safety of routine vaccinations. So in general, is it recommended that people with MS receive vaccines according to the standard vaccine schedule?
Yes, we're in flu season. We're also in the middle of a pandemic. So this is a very timely question. And I recommend that everyone get a flu shot unless there's some reason that you can't take it. So if you've had a previous reaction to a flu shot or to one of the compounds in the flu shot, then you shouldn't get it. But in general, most people with multiple sclerosis should get a flu vaccine. The flu vaccine that is most readily available now is a killed vaccine. And I know that many people with MS on specific medicines worry about whether they're getting a live vaccine or a killed vaccine based on discussions that they've had with their neurologist before. So the flu shot is safe for people with MS. Regardless of what MS medication you're on, you should mount some response to the flu vaccine, which means you're not getting the shot in vain. It is true that some of our MS medicines may make the vaccines less effective, but it should still give you some protection. So generally, everyone should get a flu shot. When we think about other vaccinations, like the pneumococcal vaccination, it really depends on the age of the person and what medications they're on, as far as when we recommend things like pneumococcal vaccines or shingles vaccines.
Are there any other special considerations that people living with MS really need to be aware of in making decisions on vaccinations?
Yeah. So, one of the questions that I frequently get, not just from people with MS, but also from people who take care of people with MS, is what is the timing? Should I wait until 2 months after my infusion before I get my vaccine? So that's one of the special considerations for people with MS. And the evidence we have right now from vaccine studies is that it really doesn't make it, the timing isn't as important. So if you're on an injectable medication, it's safe for you to take your MS injection and get a vaccine the same day. That's safe. It's not going to put you at risk for harm or change the way that you respond to the vaccine itself.
Well, thank you, Dr. Willis, for reminding us about how managing your general physical health is such an important part of living well with MS.
My pleasure, John.
Before we move on to talk with Dr. Miller, I want to take just a moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the question box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. In addition to managing your physical wellness, your emotional well-being is an important component of overall wellness. It's my pleasure to welcome Dr. Deborah Miller, Dr. Miller is a social worker joining us from the Mellon Center for Multiple Sclerosis in Cleveland, Ohio, where she also serves as the Director of Comprehensive Care. Welcome, Dr. Miller.
Thank you, John. It's a pleasure to be with you today.
I'd like to start off by talking about the influence emotions can have on our overall well-being. In addition to affecting how we perceive ourselves and the world around us, what are the other ways that our emotions influence us?
Our emotions can influence us in terms of the motivation that we have for doing things that will improve our health, such as exercise. Emotions can keep us separated from family and friends who can be very important sources of support. As you mentioned, self-concept is a way a person thinks about themselves, whether they feel that they're making progress towards important goals, or if they're stuck in a place that they can't move forward on. All of those can be really important and very limiting. So we know that as individuals have different kinds of coping approaches, they may have different reactions to stress. But when we talk about stress, we talk about how to manage it in terms of accessing your internal resources, resources from your community and your environment, and taking proactive steps to think about what concerns you have and address them in a proactive way.
Well, we've heard from Timothy, who says he's been living with MS for 5 years, and within the last 2 years, he's struggling with managing depression and anxiety. And Timothy wants to know how he can tell if this is a new MS symptom or if something else is causing his depression and anxiety. Dr. Miller, what are some reasons patients with MS might experience changes in their mood?
There are physiologic reasons related to the MS disease process. There are changes in a person's situation. Perhaps they are not able to work anymore, they're not able to perform really valued activities. And it's also dependent upon a person's coping and social support. So it could be disease related, it could be because things are happening to him that he doesn't want to have happen and he doesn't have control over. But it may also be because he has a fairly standard way of reacting to difficult situations that may not be as effective in moving forward as other ways of coping may have.
While we're talking about depression and anxiety and MS, we hear about it often. Can you tell us what the prevalence is of depression and anxiety in multiple sclerosis?
Sure. It's really hard to get an exact handle on those numbers. Most of the studies that have been done to assess the presence of anxiety and depression have been done in clinical samples. And oftentimes those are clinical samples at academic medical centers, which is not the same sort of people who are living day to day away from comprehensive MS centers. But what we do know is that depression is approximately about twice as likely in people with multiple sclerosis compared to the general population. It's estimated that there's a prevalence of depression over the course of a lifetime of 50%. That means that at some point during the course of living with MS, a person will have significant depression. And the data also show that at any given time, if you ask a group of people, are they depressed? Or if you give them a questionnaire that can more accurately assess whether they have depressive symptoms, at any point in time, it's estimated that 30% of people living with MS are experiencing depression.
You know, I often hear the words depression and anxiety being used interchangeably, but they aren't exactly the same thing. Can you help us understand the differences between depression and anxiety?
Certainly, I have to say that there is a good deal of overlap. There is with depression a anxious distress that mimics anxiety, but depression is really a loss of interest in the things and activities, the persons who used to be important to you. It's a slowness in ability to process thinking. It can be trouble sleeping, not eating correctly. Anxiety is a more specific sort of emotional experience. It is really, the key symptom is worriedness and restlessness. It's a person who has racing thoughts that are difficult to turn off, either in the day or in the night, and they are distracted from other activities because they're consumed by the worries that they have, or at least distracted by the worries they have. So depression tends to be more of a loss of affect, a lack of interest in most things in general, a loss of joy. And anxiety is I think, a more tightly consuming symptom that can be very disruptive to a person's daily life. So really get a good handle on whether a person is anxious or depressed. And many of the treatments, at least in terms of medication, are very similar for the two conditions. But the approaches that one takes in terms of talk therapy should be modified depending upon whether a person is experiencing depression or anxiety. In most cases, for both conditions, for anxiety and for depression, we recommend a three-pronged approach to managing these symptoms. The first is medication as recommended by a specialist in mood disorders. The second is ongoing support with a psychotherapist or a talk therapist. And the third is exercise. And it can be difficult to think about exercise when you're either anxious or depressed. You just don't have the energy or the time to devote to exercise. But what we find is that if a person can have the right structure to their life and that they begin an exercise program, even if they're feeling anxious or depressed, as they exercise more regularly, their mood will change. The physical activity of exercise is actually a treatment for these two moods.
What are some clues that might suggest someone is feeling depressed or anxious?
Well, a loss of interest in daily activities, sort of limiting contact with friends or other family members. For sleep, for depression in particular, if a person finds that they're either sleeping more or they're sleeping less, that's a very important signal. Another is just a change in eating habits that could be manifest either with overeating or undereating. Sometimes people lose their appetite. They don't have the energy to cook or eat. Other times people just they soothe their emotions with food. And those are usually foods that are not particularly healthy for us. Chocolates and ice cream and other sweets. So overeating or undereating, they could be accompanied by a weight loss or a weight gain. I talked before about losing interest in preferred activities. That's in general, but oftentimes it's also notable in terms of a person's sexual relations. People who are depressed are much less interested in being intimate with their partner And that can be a really disconcerting symptom to experience for both the person who has MS and for their partner as well, because the partner is wondering what's going on.
We've heard that suicide rates are higher among people living with MS. Can you explain the relationship between depression and suicide?
Certainly. There are certainly more people who are depressed than who are suicidal. But in the general population, we know that among people with major depression, regardless of what their physical conditions are or what their health conditions are, the incidence of depression is 15% higher among people who have major depression than those who do not have major depression. So that is an indication that because MS often is associated with a depressive disorder, it's estimated that about 8% of a large Scandinavian population, 8% of the people who were questioned over a 2-week period of time endorsed that they had thoughts of self-harm or suicide. Over the period of about 6 weeks, that number went up to 22% of the patients who were asked had either active or passive thoughts of suicide. That translates into an incidence or the occurrence of suicide attempts about twice as many among people who have MS as is true among the general population. And of those 2% that are more likely to attempt suicide, individuals who make the attempt are, most people who attempt suicide do not complete a suicide. It's a very small proportion who do, but it's also a higher proportion of people who attempt suicide who die as a result of their suicide attempt. So suicide is a really important cause of morbidity among people with MS, and it's an important source of really vast distress that we should be paying attention to and assessing when we're taking care of people who have MS.
Well, are there any warning signs that people should be aware of?
Some of the typical warning signs are when people start giving valued possessions away, when they start to say just vague goodbyes. A lot of times people who have the energy to commit suicide will have an unexpected increase in energy. They become more motivated to do things, to clean out their house, to make sure that they have everything in order. Those are some of the signs. In other cases, there's absolutely no indication that suicide is a concern. I have a colleague who had been seeing a young man with MS for about 2 years. And that very day, when they talked and the question was asked about this young man's suicidal feelings, he denied having any thoughts of suicide, but yet went home that evening and did complete suicide. So it's something that we should all be attentive to and concerned about and open to talking about. But I have to say that if anyone has a family member who attempts or completes a suicide, it is not their fault that they weren't paying close enough attention.
Well, if a care partner happens to notice some of the signs that you've mentioned, is there anything they can do to help in that moment?
Certainly. I think that the most important thing to do is to acknowledge their concern, that offer an expression of the importance that person is to them. Ask if they're feeling like they might be in a position where they could do something to hurt themselves, and help them get to an emergency room if they're feeling that way. In some cases, well, there's a 24-hour suicide hotline that is available across the US. I don't have that number. It's burned in my head, but I can't recall it right now. But there's
no worries. Just so you know, I have that number and I'll be sharing it at the end of this webcast. So we've got that.
Thank you so much, John. I think that all of us should have that 24-hour hotline phone number, because it's not just for people who are at risk of self-harm. It's for anybody who is feeling really distressed and has no one close to them to reach out to. I think that it would be appropriate to, if you're attending a medical appointment or any other healthcare appointment, to in advance let your family member know that you're concerned, but then to bring it up with a healthcare provider and to explain what your concerns are and what you've observed, so that a more complete evaluation can be completed.
You know, it's not just the person living with MS who can experience depression. We heard from Jeffrey, who's been living with MS for 15 years. Within the last year, he's been struggling at work because his mobility has become more of a challenge. Jeffrey now needs more support from his wife to get him prepared for work. And then after work, he finds himself extremely fatigued and he can't really help with chores around the house like he used to. Jeffrey thinks his wife is having a hard time dealing with these changes, and he's feeling guilty about it. His wife's mood has changed. He says they don't talk to each other like they used to. Dr. Miller, how common is this situation, and what advice can you provide?
It's an unfortunately common situation, especially when there's fatigue and an imbalance in usual roles and responsibilities in the home. When we talk about how people can adjust or address this, we strongly encourage them to be aware of shifts in that balance and to talk about it sooner than later. We talk about it, having the conversation when it's a little scratch and not before it becomes a gaping wound. A lot of people lose, one of the things that goes by the wayside first is the ability to have conversations about the changes that are occurring. But it's that expression of awareness that Jeffrey's not able to do as much and needs more help, would be an opportunity for his wife to express her feelings as well. And with that knowledge and with that communication, they could move forward about what might help proactive problem solving. And people should not be expected to manage this just within the two of them. It's really helpful to have the input of a therapist who can help guide the conversation, can help to sort of de-escalate when emotions get high, and can facilitate that conversation, and to become aware of what resources might be available to ease what the daily activities are like for both of them. So they need to be, I would encourage people to be open to talking with a mental health professional about their feelings and about the dynamics of their relationship, and also to reach out to the MS Society to identify what other kinds of resources may help them share and minimize the distress that they're feeling.
Now, I think we can all agree that stress is part of everyday life. However, being diagnosed with MS can sometimes make the stress of daily life feel overwhelming. Maggie says her MS symptoms are worse when she's stressed, and when her stress subsides, Maggie's symptoms settle down. How does stress impact MS, and what are some strategies that people can use to better manage it?
Well, I think that there are a couple of different explanations for Maggie's experience. One possibility is that as a person's emotion rise, their body temperature rises. And as we all know, heat is not good for people's functioning when they live with MS. So in the one case, it might be that her internal body temperature is escalating and that's making the symptoms worse. We also have a sense that when a person becomes really occupied with a stressful situation, they may be less aware of how they're moving through time and space, become more clumsy, may not be as attentive to the floor that they're walking on, and that it's the stress that's a distraction that can influence their physical functioning. So we don't want to say that stress causes a MS exacerbation, but we do know that there may be physical reasons why stress may increase a person's symptom functioning at a given time. But we also have to take into account that it may be that if you're already distressed, you may not be paying as much attention and be more reactive when you have a fall or difficulty buttoning a shirt. I think that some of the ways to manage that is with some very popular techniques that have become prevalent recently. We talk about mindfulness, about how that can be achieved with simple controlled breathing. A lot of people say that when they're stressed that they have mind chatter, that there's just this voice going on inside their head, going over and over, talking about 10 different things at once. And they can't decide what they want to focus on. And that certainly has an impact on how they manage things going on around them, much less inside their head. So there are lots of techniques to shut down that brain chatter and to increase control of your physiology with deep breathing practices. And there are many other strategies that people can learn that can help them recenter and refocus so that they're not experiencing the stress is usually caused by some outside factor. And it's our physical and emotional reaction to that outside factor. The first thing to do is to get control of ourselves with breathing and recentering. But then it's really powerful to afterwards consider what the cause of the stress was and to sort out whether it's something that you can do something about. That way the stress is a symptom that something's not right. And it's a trigger to look at what's going on and what you can do about it.
You know, we've talked about depression, anxiety, and stress, all of which can affect sleep. And we know that quality sleep is important to maintaining overall health and wellness. What should people do if they're struggling with sleep? Are there strategies to help them better manage sleep?
There are certainly very simple strategies. Stop drinking caffeine in the later afternoon. Don't watch the most crazy science fiction movie right before you go to sleep. Be sure to empty your bladder before you go to sleep. We also strongly encourage people who are waking up and having insomnia to not stay in bed. The fact of staying in bed becomes, when you're awake, becomes a habit. We really strongly encourage people to get up, to go to a different room, and to sit quietly for 15 minutes when they feel themselves more sleepy to go back to bed. A number one no-no is do not have a television in your bedroom. And don't use, although it's very difficult in these times, don't use your bedroom as your office, or at least don't use your bed as your office. We say that there are only two things that a bed should be used for, that's sleeping and sex. And everything else should be done in some other part of the house. Also, there are some really great online self-help strategies for managing. I know that there are some on the MS Society website, but there are, I think Can Do MS also has some material. And just for the general population, there are very helpful online strategies that a person can take in. But it's also really important if sleep becomes a major issue that you feel is threatening your health, that should be discussed with your neurologist. And it may involve a referral to a sleep specialist, who is also usually another neurology specialist, who looks at, who can study your sleep patterns to determine how well you're sleeping when you're sleeping. If you have sleep apnea, because there are other causes that could contribute to poor sleep in addition to MS. So I would start with self-help strategies, go to some online some online resources, but only from trusted, known resources. I strongly encourage people not to just look at the first website that comes up that's addressing your concern. Everybody's got a website now, and everybody's got a podcast. So it's really important for people to be able, and John, you're part of the good guys.
I try to be, Dr. Miller, I try to be.
Absolutely, but there are people who are pretty crazy, who have a whole new platform for expressing their opinions. So we really encourage people to be aware of the source and the credibility of the website that they're using.
Couldn't agree with you more. We've covered a lot of information today. So first, I'd like to ask Dr. Willis to join us, and I'm hoping you'll each share the top 3 takeaway messages you'd like our audience to keep in mind. Dr. Miller, I'll start with you. Top 3 takeaways.
I would say that depression and anxiety are some of the most distracting and disturbing symptoms of MS, but they're also the most treatable. So that we may not be able to completely halt disease progression, but we can do a lot to help manage depression and anxiety. The second is that people, and I didn't talk about this before, but I was with a group of people with MS last night who said that it's important to grieve their losses, that you can't ignore when something is no longer part of your life. And it's only after you do that that you're able to move on and make adjustments and adaptations. And the third is to be aware not only of how MS is affecting you, but how it's affecting the rest of your family, and to take as much attention to that and to deal with it, because that's an empowering process that can make you feel more in control.
Dr. Willis, what are your 3 top takeaways today?
Well, first, learn as much as you can about your multiple sclerosis. Everyone's MS is different, and like you heard today, MS medicines are just the tip of the iceberg. So learn as much as you can. And then second, MS is a lot. You can't do it alone, and you need more than just a neurologist on your team. So everyone needs a primary care physician, and everyone needs the support from family, friends, whoever helps support you emotionally. And then third, be active and be proactive with your health. Ask questions whenever you go in for your visits. Look for answers to the questions that you have, and you know, your visits with your provider should really be a dialogue. Instead of just accepting advice, it should be a dialogue and a discussion.
Well, I first want to thank everyone who submitted your questions, and I especially want to thank you, Dr. Miller and Dr. Willis, for joining us today and sharing some great information about how people can go about living well, both physically and emotionally, with MS.
It's a pleasure to be with you.
Well, I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are the resources that you can count on to be current and credible. These are the resources that Dr. Miller just referred to as some of the good guys. I want to remind you also that if we were unable to get to your questions today, the National MS Society's MS Navigator team is your best partner in answering your questions and connecting you to the very best information and resources. And it's worth mentioning that the health insurance open enrollment season is right around the corner. MS Navigators want you to know that they have a lot of great resources and tools for anyone looking at their 2021 health insurance options. There's even a special team that's setting up appointments for Medicare beneficiaries during open enrollment to help ensure that your 2021 coverage is exactly what you need it to be. You can contact an MS Navigator by phone, email, or by live chat through the MS Society's website. And for more information and resources on living well with MS, please go to the Society's website at nationalmssociety.org and search Living Well with MS. As Dr. Miller alluded to a moment ago, we're in the midst of an emotionally difficult time for so many people, and I want to make sure that you're aware that the National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or your loved ones. And you can reach them by calling 1-800-273-8255. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. With vital funding from supporters like you, the National MS Society will work to ensure that resources and programs like today's are available, and that the MS research community rebounds quickly from COVID-19 so the progress and momentum toward finding a cure continues. As you're able, please make a donation to the Society's COVID-19 Response Fund by texting the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll consider contributing today. You can connect with the National MS Society on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And please make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS, research, and updates on upcoming programs just like this one. I'd like to once again thank Dr. Mary Alyssa Willis and Dr. Deborah Miller for joining us today. And I'd like to thank everyone who's joined us for your great questions. Please remember that a recording of this webcast is going to be available for your review on the Society's website at nationalmssociety.org/MSexpert. Now I have a favor to ask each of you. Getting your feedback on today's webcast is really important to us, so you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section, and on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continually improve, and it helps shape future webinars. The survey takes just 1 minute, so I hope you'll take a minute and please fill it out. Thanks again to Sanofi Genzyme for their sponsorship support and for helping the Society make programs like this one possible for our MS community. On behalf of Dr. Mary Alyssa Wellis, Dr. Deborah Miller, and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.